7:41, everybody, and a disturbing trend in breast cancer patients putting younger women on alert. Listen to this. A recent study conducted by the American Cancer Society found the rate of breast cancer among women under the age of 50 is on the rise. So here are some of the numbers. The study shows a steady increase of just over 2% in women in their 20s over the last decade. A little over 13,000 women under the age of 40 will be diagnosed with invasive breast cancer this year.
But the good news is that despite the rise, breast cancer deaths have dropped 10% over a 10-year period. Early detection and knowing how to advocate for yourself is really the key to winning the battle. And joining us this Monday morning is Dr. Paul Barron. He is the director of the breast cancer program at Northwell Lenox Hill Hospital. And we are also joined by one of his patients, Elle, who is here to share her courageous journey with us this morning. Thank you both for being with us.
Thank you.
Thank you.
Very important discussion, especially being October, Breast Cancer Awareness Month. Dr. Barron, we'll start with you because early detection for cancer really is key. However, screenings are recommended at 40. So if you come in, they may recommend do not come back until you're 40. What is the guidance here, since we are seeing more cases for women in their 20s and their 30s?
Right. So that's definitely the challenge, is that women under 40 are not getting routine screening. So there is something you can do, which is called a risk assessment. There's some online software for that. One is called the Tyrer-Cuzick or IBIS. The other is called Gale model, which you put in features like age of first menstrual period, if you have kids, if any family history of breast cancer, and that will give you a number as what is your lifetime risk of breast cancer. And basically, in the United States, the average risk is 15% or less. Lifetime risk is about 1 in 8 women. However, if your risk is over 20%, that means you have an elevated lifetime risk of breast cancer. And it's recommended those women consider getting breast screening with mammography and MRI under 40. So we'll have people start getting mammograms and MRIs in their 30s for those reasons. However, despite that, a lot of women with cancer in their 30s, they're hard to detect, certainly on mammogram, because the breast tissue is very dense and doesn't show up well on mammogram.
Yeah, I mean, take Elle, for example. You're 29 years old, right, when you noticed that something was wrong.
Yes.
So tell us a little bit about your story and your journey.
Yeah, so I had felt a lump in my right breast, and I had went to the doctor a couple times, and they said it's probably nothing. And after a few times of going, I ended up going to my gynecologist at the end of last year, November 2023, and they ended up sending me, after bringing it up again for a third time, they ended up sending me for imaging, and that's when I got my diagnosis that I had invasive breast cancer.
At 29?
30.
30.
Yeah.
30. So, Dr. Barron, when you look at some of those factors you talked about, you do your checklist, was this something that fell in line with that?
Well, in her case, typically women with cancer under 40, they show up with a lump they can feel.
Right.
Whereas women over 40, they're usually showing up with a cancer that's found on mammogram, the most common way. So we tend to find them earlier. If they're found on screening, they frequently can avoid chemotherapy. They can avoid, it depends on the type of cancer. They can usually avoid a mastectomy and can have a lumpectomy.
But you underwent chemo and radiation.
Yep, chemo and radiation. I finished radiation in July. So I kind of went through the whole process.
Yeah.
My cancer had been advanced enough at that point where I had to go through it, and I was also hormone positive as well. So all those factors, and HER2 positive, so all those factors contributed to me having to go through chemotherapy.
Yeah.
Thankfully, you listened to your body.
Yeah, for
in
sure.
that case.
Yeah.
Dr. Barron, we've been hearing a lot about this triple negative, triple positive breast cancer. Can you explain what they are and some of the typical risk factors for those types of breast cancer?
Sure. So breast cancer has these receptors on it, the estrogen receptor, progesterone receptor, and the HER2 receptor. And if you're positive for those, then we know we have a target that we can treat with a drug that's a HER2 blocker, an antibody that attacks the HER2, or an anti-estrogen medication. Whereas you're triple negative, that means we don't have any drugs that can be targeting those, and those patients almost always need chemotherapy. So fortunately, in Elle's case, there is ER positive and HER2 positive, so there are drugs that we can use for it, and so that's great for her.
Well, I appreciate you both coming in, Elle. Thank you for sharing your story, and
Thank you
for being persistent too. So that's the advice for other women too. When you feel something's wrong, keep going to the doctors, right?
Absolutely.
Dr. Barron, Elle, thank you so much. Appreciate it.
Appreciate it. Thank you.
Thank you.